you don't have to be the CEO of your company. Meaning, if you just want to supervise or you just want to see patients, you can still do that. They'll bring someone in to take over all the stuff that you don't want to do, right? The idea is always finding good people and getting them into a situation where they can do what they want to do.
This episode is sponsored by Therapy Notes, therapynotes.com. Be sure and check them out and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Hello, everyone, and welcome to the podcast. This is episode number 330 of the Practice of Therapy podcast. I'm Gordon Brewer, and glad you've joined us for this episode because it's a really good one. I had the privilege of interviewing Dr. Joshua Rosenthal, and Josh is a psychologist who has a large practice or had a large practice in Manhattan, and we talk about what it was like for him to sell to a private equity firm. And it was very informative for me, especially as I mentioned in this particular episode, that I've got this retirement kind of on the horizon for me, and just thinking about, okay, when I retire, what am I going to do with my practice? So I learned so much from Josh, and we got to spend some time talking after we stopped recording. So this is just some really great information, and I'm looking forward to you hearing this. And I think after you listen to this, the idea of selling to a private equity firm might not sound so scary to people. So anyway, stay tuned to listen into my conversation with Josh. And it's a good interview. But before we get to my interview with Josh, a couple of things I'd like to point out to you and point you in the direction of. First of all, if you'll go over to practiceoftherapy.com, which is my website, I'd love for you to just check out the resources we have there. And one thing in particular, and by the time this comes out, I'll have a button up there for you to check out Mental Health Wear Tennessee. And this is a collaboration I've done with a good friend of mine, Ashley, and really providing some swag items for mental health providers, and also just items that promote mental health awareness. This month, May, is Mental Health Awareness Month. And so, so be sure and check it out. And there'll be a link there on the homepage of practiceoftherapy.com, or you can simply go over to practiceoftherapy.com/mentalhealthweartn, and that'll get you to the landing page and the shop there for mental health wear. And the other thing too is that you can get customized items from Mental Health Wear Tennessee. I just recently ordered t-shirts for my staff with our logo on it, and so that's something that we can do, and it's very cost effective. It was not that expensive at all for my friend Ashley to produce those for us. So anyway, be sure and check it out, practiceoftherapy.com, and just click on the link for Mental Health Wear TN, and that'll take you to the shopping page. And also, before we get to my conversation with Josh, I'd love for you to hear from one of the members of the Psychcraft network, which this podcast is a member of. And another organization that I started back in 2022. And so you can find out more about all the different podcasts on the Sightcraft Network by going simply to sightcraftnetwork.com. And here is one of the members of the network, along with a message from the sponsor of our podcast, Therapy Notes.
Hi there, I'm Julie Harris. I'm an accountant and I'm the host of the Therapy for Your Money podcast. In the podcast, we talk about all things money and finance, specifically for therapists in private practice. You see, my accounting firm, Green Oak Accounting, specializes in working with therapists in private practice. That's all we do at this point. And over the years, we've learned so many tips and tricks for how to make the financial side of private practice work better. After all, we've seen under the hood of hundreds and hundreds of private practices. So in the podcast, I share lots of financial tools and tips and mindset shifts to help you have a profitable private practice. Therapy for Your Money is part of the Sightcraft network of podcasts, a network of independent podcasters just like me. So head over to therapyforyourmoney.com to hear episodes on topics like growing your practice, making more money without necessarily working harder, weathering the ups and downs of a practice, and so much more. Come join me at therapyforyourmoney.com.
Ready to upgrade your practice from a rusty bicycle to a shiny new sports car? Buckle up, because Therapy Notes is here to turbocharge your journey. It's the comprehensive practice management system you've been craving, equipped with everything you need to navigate patient records, schedule seamlessly, host remote sessions, craft detailed notes, and tackle insurance billing with ease. And guess what? It's your trusty sidekick, available whenever and wherever duty calls. Picture having more quality time with your clients, all thanks to this digital assistant that never clocks out. Here's the kicker. It's Gordon approved, so you can trust it's the real deal. Bid farewell to paperwork headaches and embrace a new era of efficiency and top-tier care. Ready to level up your private practice game? Swing by practiceoftherapy.com/therapy notes and punch in promo code GORDON for 2 months on the house. Enjoy the show.
Well, hello, everyone, and welcome again to the podcast. And I'm really looking forward to you getting to hear from Josh Rosenthal. And Josh, welcome. I'm looking forward to this conversation because it's one that I've been interested in, and just around leadership and selling your practice and that sort of thing. I'm kind of at that age where that's on the radar for me, and just thinking about, what's next as far as I move towards retirement, that sort of thing. But Josh, as I start with everyone, why don't you tell folks a little more about yourself and how you've landed where you've landed?
I'm a licensed psychologist in New York, New Jersey, and Florida. I have the telehealth license there. Been practicing since 2000. Started my company, Manhattan Psychology Group, in 2011 and grew it to about 300 staff, maybe 250 clinicians. And then recently sold to private equity, an MSO called Arc Health, backed by a private equity group, in September 2023. And life is pretty much the same for me. I'm still CEO. I have an employment contract with them, still doing the things I love, which are leadership, growth, and culture. But now we have an organization to support us, take care of a lot of the back end stuff that's really kind of tricky and time consuming. And we get to just keep focusing on patient care and hiring the best people and culture and all that good stuff.
Wow. Yeah, that's really cool. And I know that that's a conversation I've had with a few people, not necessarily on this podcast, but just thinking about, okay, if a person gets ready to sell a practice, what are the different ways that they can go about that? And what you mentioned is a model of the owner staying on as kind of the manager of the practice or the CEO of the practice, but actually it being actually owned by someone else. So take us through your process of that and what you've learned through all of that.
Well, we're going to need like 2 to 3 hours for the whole story. I'll give you the abridged version. I think every clinician comes to a turning point where they sort of say, do I see myself doing this for the next 10 years? And I had been seeing patients for, 13 years. And I was just starting to feel like, what's next for me? And then at the same time, the business is getting busier. So you also have to decide, are you going to focus on the business or are you going to focus on patients? And I decided I wanted to focus on the business. It was more rewarding for me. I thought I could help more people by doing that rather than doing one-on-one therapy. And it just felt right. So I did that and grew the business to a point where, it was sellable, right? Of the right size and scale and infrastructure. And then you start thinking about, well, who am I going to sell it to? And what's going to be my role after I sell? And not all, private equity groups are created equal. There's a lot of bad press out there, bad situations where private equity has come in and bought companies and squeezed them and pushed people out and not really focused on patient care, but focused on money. And so you have to be wary of those buyers. And, I found a broker who I trust, found a law firm that I trust. And we went through a bidding process where you go to market. Basically, it takes about a year. And you interview them as much as they're interviewing you. And you put on your psychologist cap and you try to figure out who's a good person and who's being honest and genuine and really cares about patients. And then you pick someone, and it's basically a marriage. You don't really know how it's going to work out. You don't have a lot of time to live together before you sign the paperwork. But if you have the right people and the right team to help you, I think this is more of an option today than ever for psychologists and mental health professionals and behavioral health professionals. Because in the end, there's a lot of things about the business that we just don't want to do. And there's a lot of people that are better at it, back end, treasury, finance, marketing, HR, all those things that are just not why we went to school. And if you can partner with the right person and also create a retirement plan. I mean, the idea is to create a retirement for yourself so that you have stability and your family's taken care of. I was getting stressed out about cash flow and payroll and people leaving and, HR issues. I mean, just all these things are so stressful. And so now to have someone that I can learn from and who can support me and my team is the best feeling in the world.
Right.
So I wanted to come on the podcast to sort of pay it forward, meaning like let other people know that there are some good private equity groups out there that really do care about patients. And it might be an option for people that didn't even think about it.
Right. Yeah. So one of the things I'm curious about is, one of the things about owning a practice is you feel like you can do it kind of your way. And that's, I think, one of the reasons that most of us go in, at least one of the reasons I went into private practice was just for the autonomy it gives you and being able to be the boss, so to speak, and make all the decisions and that sort of thing. What's your experience been around those issues, selling the company?
Everyone's afraid of that. If I sell, do I lose control? And it's actually quite intuitive if you think about it, because they want to buy. Well, first of all, there's two models. There's private equity models that buy broken companies and fix them. And there's private equity companies that buy good companies and help them continue to be good. So if you have a broken company, you need help, right? But if you have a good company and you're making money and you're hiring people and you're doing quality care and you have a good reputation, then you don't need someone to change that. You need someone to help you with the other things. So we keep our identity, we keep clinical control, and they focus on the things that they're good at. So a lot of people think like, oh, they're going to come in and they're going to tell me what to do. But why would they tell you what to do if what you're doing is working? Right. Because in the end, if they mess with your patient-doctor relationship or patient-therapist relationship, the patient's going to leave and then they're going to lose money. And they're not in the business of losing money. So if you actually think about it, they don't want to do anything to mess up a good thing. So really the question for yourself is, do I have a good thing?
Right. So in preparing for sale, what did you find that you needed to do in order to, I guess, make it more sellable or make it so that the transition was good and all of that sort of thing?
There's personal things and there's professional things. Personally, you have to figure out what your goals are. Why do you want to sell? How much do you need to sell for it to be worthwhile? I mean, just dollars and cents, right? You need to crunch some numbers.
Right.
What do you want your life to be after you sell? right? Like you need to have those things clearly outlined before you go in, because everything is going to change during the process. It's a roller coaster, an emotional roller coaster. And you really need to have clarity on what your goals are. Otherwise, you might end up doing a deal that's not really the deal that you wanted in the beginning. Now, things change and you have to be flexible, right? But some things you can't really be flexible on, and you need to know what those are. So that's personally. Professionally, you have to have your house in order. If you do not have your finances and your books and your HR and your notes and your stats in order, it's going to be a disaster trying to give that over to someone to analyze your company. And it's going to end up hurting you, because they're going to say, this is so disorganized, we don't really know what's what. We're going to give you less to cover the risk that it's not what you say it is. So you really have to get your house in order personally and professionally. Otherwise, you're going to get less, basically. You're going to get less of the goals you want and less value or money for your practice.
Yeah. Yeah. What sort of folks did you find that helped you with this process? I'm just thinking, off the top of my head, certainly you'd want an accountant to evaluate the company. You'd want attorneys that are going to be kind of, I guess, I'm thinking of what were the team of people you got around you in order to begin to look and decide
great question.
Great question. Sell to. Yeah.
It's all about your team, because you cannot sell your own practice. And if you try, it's like representing yourself in court. If you try, it's not going to end well. So the first thing you want to do is you want to find a good banker broker. Now, they're all, they all mean well, right? But they're all different. They have different fees. They have different ways of working. And so you need to do your due diligence. I spoke to 5 or 6 different brokers. I called references on every single one. I had multiple meetings with them, and you end up settling on someone who you really think is who they say they are, right? I hired a broker named Mertz Taggart, Kevin Taggart, amazing guy. I would plug him 1,000 times. And so he starts with that, and he will look at your business. He'll give you a valuation at no cost, no commitment. And then you go from there, right? And so you have your broker. Let's say you hire your broker, and then you need a tax person. Now, it could be your CPA, but most CPAs are not familiar with deals, right? So you need a deal tax person. Very, very important, because the biggest hit you're going to have is on taxes on the deal money. You're going to lose a lot of money depending on where you are. I'm in New York City, the worst when it comes to taxes. California, the worst. So you need a deal tax person, and then you need an attorney. Now, you need an M&A attorney, not a family law, not a corporate. You need an M&A attorney. There are so many things to know about, so many bells and whistles, so many teeth to these contracts. They're all interconnected, and you need someone who's willing to spend the time to explain to you what these things mean. Because when you do a deal, there's probably 8 to 10 different pieces of paper or contracts that you're signing, and they all are intertwined. And if you don't understand how they're connected, you're going to end up making a mistake. So I ended up spending way more money in legal fees, but it was worth it because I really understood what was happening. So I would say that's the core team. You need a broker, you need a tax person. It could be your CPA, or it could be your CPA plus someone who specializes in deal taxes, and then your attorney. And then, if you really want to get fancy, then, get someone in the private equity world. Get someone who's in that world that knows what the private equity guys are thinking and can help you negotiate.
Yeah. Yeah. How did you go about finding these people?
Google. I went to Google, and I just Googled, behavioral health broker, mental health broker. I'd gone to a conference, an M&A conference, and I saw some people talk. That helped too. You're cross-referencing, you're double checking, you really got to take your time. I mean, there's no rush to it. You don't want to sell when your house is on fire. You want to sell when things are good, and just take your time.
Yeah. Yeah. So as you started putting all of this together, what were kind of the first steps that you saw that you had to do within your practice in order to set it up? I mean, I know you mentioned, getting your records in order and the finances in order and that sort of thing. Where did you find that you had to spend the most time particularly with a large practice like you have.
Yeah. So we're three companies, sort of branded together. We have mental health and testing. We have special education services, and then we have ABA. We're doing a lot of different things. We have 3 different EINs, actually 4 EINs, because we actually have a early intervention company. I would say, the clinical stuff, if you're doing good clinical work, that sort of runs itself. You've got an EMR, it's taking notes, you've got your sessions. It's really the HR stuff, right? Like,
okay,
how are all your staff, are they categorized properly? W2, 1099s? Are you, complying with labor laws? Like the really nitty gritty HR stuff, PTO, census, if you have benefit packages, if you have 401k packages, all that really sort of nitty gritty back end stuff. If you're a large organization, really you need someone who has that all organized, because they're going to ask for that stuff over and over again. Right. And it's very time consuming.
Yeah. Yeah. So the other question, I guess, that maybe comes up is just thinking about your people, your employees and that sort of thing, and prepping them for this, and it being something that doesn't create a lot of fear and create a lot of, consternation, all of that.
Yeah. Yep. Yeah. It's the unknown, right? It's the unknown. It's the unknown for me as I'm going through the process and picking people to be on my team and picking hopefully someone to buy the company. It's the unknown for leadership, what's going to happen to their jobs after it's sold. For the most part, the patients and the providers would have no idea, meaning their relationship is not affected. And that was intentional, right? Because again, that's where the rubber hits the road. You don't mess with that. You don't mess with the doctor-patient relationship. If you do, everything falls apart. So they really wouldn't be affected at all. It's really senior leadership, people that are responsible for running the day-to-day operations, the people that report to me, the people that are then integrating with the new company, the buying company, Arc Health. Those are the people that you have to be very thoughtful about in how you tell them, when you tell them, how much information to give to them at different points. You may need them to be part of your process. During the sale process, you have what's called management meetings, where you meet with potential buyers. Maybe you go out for dinner and then you have like an all-day meeting with them. And so they may want to see your leadership team. They may want them to be at those meetings, not just the owner, especially if they're critical. And so you need to figure out when you're going to tell them during the sale process. So I think if you're thoughtful about it and you have a good working relationship with your existing leadership team, then it's easier. But if you don't have a great culture and you don't have good communication, it's going to be more challenging.
Right. Yeah. So I know one of the things we were talking, and I think this fits in well with this, is just thinking about leadership, and particularly with the size practice that you have. What would you say are some of the essentials that you've kind of figured out in, leading, particularly professionals? I mean, it's a different ballgame when you're leading people that are also very intelligent and very educated.
Yep. I mean, everyone wants to have psychological safety, right? And everyone wants transparency. So no one wants to be the last to find out, and no one wants to feel so uncomfortable or unsafe that they can't share what they're really thinking. Because when you have those things, when you have lack of transparency and you don't have psychological safety, you're not having honest conversations with people, right? So then people start talking outside of meetings and outside of one-on-ones, and it just gets away from you. So I've always tried to make sure that we have those two things as much as I possibly can. Now, if you're an owner of your company, there's always going to be things that you're not sharing with your staff because you're the owner, right? But aside from those things, you really want to try to be as transparent as possible, because the transparency breeds trust, right? And if you have people that are key employees, they need to trust their leader. So I really think that those things, come a long way. Sharing as much information as you can along the way, supporting your staff, meaning trying to put them first as much as you can. During the negotiation process, I was negotiating on their behalf with the buying company to make sure that they were taken care of very well. And those things go a long way, because, the people that have the least amount of control about their future are always feeling the most anxious.
Right. Right.
And you don't want people to feel that way. You want them to feel like you're protecting them. There's a future for them. And again, if you have a good company with good people, no one's going to want to mess that up.
Right. Right. Yeah. And so it's really important to have, and I'm repeating kind of what you said, but it's really important to have the structure of your company, the structure of your practice pretty sound before you even begin the process of trying to sell. And if you're just trying to get out from under a lot of trouble, that's not going to make it easy to sell.
They're going to know it. First of all, you can't hide anything. When you go through the due diligence process of selling, they joke it's like a colonoscopy and an endoscopy at the same time. So you can't hide. It's going to come out, and it's going to hurt you, and it's going to cost you money. And so, there's no point to it. Yeah, it's just bad. If you're selling in a bad moment. Now, look, everyone's different. Like, I mean, you could be in a really tight spot and you need to get out and you can't continue. And as long as you're honest and transparent about those things, then you'll have a better experience. It's when people try to hide things or cover up things, they're not transparent. That's when everything breaks down.
Right. Yeah. It's kind of like selling a house. If you've got a bunch of mold in the crawl space, you can't try to hide that in selling a house. Yeah.
It actually depends where you sell, though. Some states they have before and after. So
true. So, well, Josh, with all of this, how has it changed your life in being,
owner to now having my own boss? I mean, overall, it's been positive. I feel like I got the deal of a lifetime. I feel like, again, my broker and my law firm, McDonald Hopkins out of Cleveland, plug them, were amazing. Literally, I'm so grateful to them. It's been an amazing experience. Not only did I get great value for my company, but I think that the partner that we now have with Arc Health will ultimately be way better for my staff and my patients than I could ever do on my own. So, and now I'm part of something that's bigger than myself, right? Even bigger, right? And there's so much I get to learn now from Arc Health and their executive leadership team. So, look, I know everyone, can have different experiences, and there's, a lot of bad press about PE and selling to PE, but for me, it's been amazing. And anyone who's interested, I would definitely look into it, explore. I'm happy to talk to them about it or talk to someone else, because there's a lot of good that can come out of partnering with a large organization.
Right. Yeah. Well, I think this is going to be a good resource for people. And I want to be respectful of your time, Josh, but what sort of parting thoughts would you have just around this whole topic?
I mean, it's sort of similar to what I just said. Like, if you're curious about it, ask about it. You don't have to be this huge company making, $30 million a year to be sellable. You can actually be much smaller if you're doing quality care and you have good leadership and you've got a vision for the future. Private equity groups and venture capital people that are interested in mental health and behavioral health love that. I mean, there's nothing more that gets them more excited than an energetic, smart, personable clinician. Right. And if you fit that bill and you've got, gas in your tank to do new things and you want to grow, then I would absolutely consider thinking about selling your practice.
Yeah. Well, that's a great advice. And I think it's a lot to think about. I know, as I mentioned early on, I'm in that phase of life of thinking about retirement and, just what I would like to see happen with the practice. And
we could have a sidebar.
Yeah. Sure.
And I would say the last thing I would say is you don't have to be the CEO of your company. Meaning if you just want to supervise or you just want to see patients, you can still do that. They'll bring someone in to take over all the stuff that you don't want to do. Right. The idea is always finding good people and getting them into a situation where they can do what they want to do.
Right.
If you can match good people with what they really want to do and just leave them alone, then that's what works. Right. So it's not one size fits all. Not at all.
Yeah. Awesome. Well, Josh, tell folks how they can get in touch with you and if they want to ask you questions or
Sure.
connect with you.
So our website is manhattanpsychologygroup.com. If you want to send me an email, my email is joshua.rosenthal@manhattanpsychologygroup.com. You can just go to the website, fill out a form, send me a note. If the email if it's too long, we do have long email there. So yeah, but please reach out if anyone is interested. I'm happy to talk about this. I love talking about it. I'm happy to pay it forward. And, there's a lot of people out there that need help. And I think that if you have a mental health practice, and you want to grow, there's people out there that want to help you grow.
Right. Yeah, that's great. And again, thanks, Josh, for being on the podcast. Well, folks, I hope this has given you a lot to think about. I know it did for me, and just talking with Josh and just really thinking about what it means to sell your practice. I know for a lot of folks that are listening out there, they're really on the opposite end of the scale here of just thinking about, okay, how do I get my practice going? How do I start making more money with my practice? How do I become more profitable in my practice and make things run well? But eventually you get to a place where, you might be ready to change or might be ready to hand over the reins, so to speak, to someone else. And at least for me, a lot of what Josh had to say was just reassuring in that we want to be able to pass the torch, so to speak, and know that things are going to be run well, and also be that our people that are working for us and our patients are looked after well. So again, big thanks to Josh, and hope you found this just a really good episode. I know it was for me, just being on the receiving end of his wisdom. And we'll have links here in the show notes and the show summary for you to be able to get in touch with Josh. I know he's on LinkedIn and very active there. And he's got I've discovered he's got an upcoming training around this whole topic that I signed up for. So it's on LinkedIn. If you'll go to his page, and we'll have links in the show summary for links to his LinkedIn page. But you'll see that event. I think it's coming up on May the 29th. So we've got a few weeks left here before we get to that. Also, go over and check out practiceoftherapy.com and just check out all the resources we've got there. And in particular, check out Mental Health Wear TN, and you'll see a button there to get you to that page and find out more about some pretty neat stuff around mental health awareness, addiction recovery, and just some different swag items that are available for people. Ashley's put a lot of hard work into this website and this store, and I'm going to help her share it around. So be sure and check it out. And also, big thanks to Therapy Notes for sponsoring the podcast. They are the leading electronic health record system for mental health providers. They're who I use in my practice. And I'm just constantly impressed with all the new things that they're adding and the support that they give. It's really a great platform, and that you'll find everything you need there. They've got a patient portal you can set up so people can schedule with you online and also make payments online. All of the things that you need are there with Therapy Notes. So be sure and check them out. And also be sure and use the promo code just Gordon, Gordon, and you can try them out for 2 months for free. And you can get to them by just simply going to practiceoftherapy.com/therapy notes. Well, take care, folks. Look forward to being with you again next week. Got a lot of great guests lined up. And do take time to follow us wherever you might be listening to the podcast, or subscribe, whichever it is on the platform you're listening to this on, and leave us a review. I always love getting feedback from people about the podcast, and looking for the topics that you're interested in. And if there's a particular topic that you're interested in that maybe I haven't covered yet, shoot me an email. You can just email me at gordon@practiceoftherapy.com, and love to get that feedback from you. So take care, folks. Have a great rest of your day or weekend or week that you're in. Take care. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.